Good morning, everybody. Starting with me today with a progress report with my presentation of novel digital health approaches in oncology. This is my thesis title. I am Seba Aljomaa. I am a pharmacist basically, and I started this year my PhD in the CTM to achieve my mission through my vision. Starting with it, I'm looking for improved quality of life in oncology via new approaches, and my mission to find the best digital health interventions for cancer patients. And starting talking about my two projects for this year, the first one is to compare the effect of the digital health interventions on the quality of life of individuals facing cancer by conducting a systematic review and meta-analysis. Let's talk about this project. Basically, all of us know the burden of the psychosocial symptoms in the cancer, which could affect the patients. 35.2 could be affecting or suffering from anxiety, and also the pain in 44% approximately among cancer patients. We are believing in standard care, but I think that it's not enough because of the barriers to get what we want to achieve through this therapy. We know, especially during the COVID pandemic, that there are a lot of barriers, like the distance, like the maybe problems that affect also the patient's attitude to get the benefit of this. So the WHO recommended the digital health interventions as a new approach for these patients, especially that now we could talk about the digital health, or we could talk about the adaptation of technology around the world. So digital health is expected to improve quality of life of the patients suffering from cancer. So our aim to investigate the efficacy of the digital health interventions in oncological care. It's just an overview about the digital health interventions, mobile health, and electronic health, comparing to the standard care. So our clinical question gonna be, does e-health and mHealth change the mental and physical health outcomes of cancer patients? And our PICO population is cancer patients during the therapy. And also, we are comparing the digital health interventions, for example, VR and the exergaming as an e-health, as an mHealth, the mobile applications, to the conventional usual care of the cancer patients. And our outcomes are the mental and physical health outcomes like pain, anxiety, fear, quality of life, satisfaction of the patients as well. So our hypothesis that digital health interventions gonna improve or will improve the mental and physical health outcomes among the cancer patients. And we are looking for to implicate the digital health interventions on the level of the patients and physicians to improve the quality of life and the satisfaction in oncology, also on the level of the policymakers to access these interventions. We have conducted the systematic search and used the PubMed, Embase, and Cochrane databases. As we see, these are the key searches, or search keys, we used to get the results. I will go through the key articles I was scrolling, and I'm gonna talk about the basic purpose of these key articles, which is the VR in symptom management. And the point that the VR, or virtual reality glasses, could be used in an immersive environment to improve the pain, fear, anxiety, distress symptoms in the patients of cancer, children that they're suffering from the injection of the needles, which is the first and second key articles are talking about how to manage the symptoms also in the women suffering from the breast cancer. So we started the selection with about 25,000 going through 18,000, and now we are on the level of the abstract and the title selection about 92% we have achieved until now. And And now I'm gonna talk about my second project, which is investigating the distracting effect of tablet, virtual reality, and analgesic cream during regular pricking of childhood cancer patients. And basically, I have mentioned this point in my previous speech about the suffering or the problem of pricking in the children with cancer. They are suffering from the painful procedure of the repeated needles about once a week in the children with cancer. So it's painful, it could cause fear and also distress in the children. Unfortunately, the pain relieving methods currently available, it's gonna take time to get the achievement or to relieve the pain, like the lidocaine cream, and we have limited availability of other resources like the iPad and virtual glasses, but still, virtual reality glasses are a novel immersive technology with the capacity to distract the patients and guide their focus away from the pain. So our aim to define the most effective distracting technique to reducing pain and fear on childhood cancer patients during the regular pricks. And for that, we are asking which is the most effective distracting method in reducing pain and anxiety and fear in childhood cancer patients suffering from the pricking. We are comparing first of all, the interventions, the tablets, VR glasses, local creams, methods to the current and usual methods, which is no distracting method. And our also results are the pain and anxiety, fear, quality of life satisfaction measurements. So our hypothesis that the use of the VR glasses is the most effective in reducing childhood cancer patients undergoing pricking. To implicate that for the clinicians level and also the policymaker to access. So our inclusion and exclusion criteria in this part to get the patients undergoing the treatment of the cancer, the active one, but we don't need any problems that could prevent using of these interventions like visual or end-of-life treatment. So to achieve my vision, to improve the quality of life of the patients suffering from cancer, I'm looking forward going through these two projects this year. Thank you for your attention. I'm gonna finish my speech, the early speech of today, with Albert Einstein. Be a loner that gives you time to wonder, to search for the truth, have holy curiosity, make your life worth living. Thank you so much.
Congratulations, it was very interesting. What do you think, what is the difference using the digital health for patients between adult patients and children patients?
Okay, so basically the difference could be how to choose the digital health intervention. For example, the hot topics in the children suffering from cancer using the VR and exergaming. But we could notice like the mobile applications, for example, are more popular for the adults. And also technically on the scales, there are scales for the children specifically to measure the pain, fear, and anxiety, and whatever. And another ones could be adapted because the most popular ones are for adults.
Thank you. Next question.
Hi, I was just wondering, how do you plan to measure pain and fear in very little children who cannot really express themselves?
Okay. Thank you so much for your question, and I'm sorry, Professor, thank you for your question. The point about using the measurements is using the faces in the scales. So it's not written, it's not scores, it's about faces. If I am feeling that it's so painful, a bit painful, choose a face, and it's gonna be translated to the score after that.
Thank you.
Thank you so much.
Okay, may I ask you that you mentioned in your first part of your presentation that you didn't find any full text paper related to this subject. How it would be possible to publish such a meta-analysis? Maybe I misunderstood, so could you explain this, because that's the last one was empty.
Thank you so much for your question. The point that now we are working on to finish the title abstract selection, because basically there are a lot of publications in this regard, and some of them is related also to the social media, which is a part of the digital health interventions. And the next level gonna start in 1 or 2 days is to start with the full text
Okay,
selection.
so you didn't do this until now? Yes,
in progress.
Okay. Any other question? We have plenty of time.
Congratulations on your presentation. I just wondered if, in your personal experience, do you know any pediatric centers where e-health and m-health are used in the daily practice?
Okay. Thank you so much for your question. To be honest, this is a new trend in the medical field about using the digital health interventions. It started to be more and more hot topics, and the using of the digital health interventions now in the daily routine of healthcare, it's not, but still it started in some places or some hospitals. For example, in Semmelweis Pediatric Center, we started to use the VR for the pain management of the children with cancer.
Good morning. Brilliant presentation. Congrats. So in the first project, one of your key articles was the application of VR in women with breast cancer. So do you plan to pool together in the population adults and children, or just one of the?
Thank you for your question. It's really an important point that we talked with the statisticians about this part, because we are looking for the digital health interventions in cancer patients, and we started to plan to make subgroups in this regard. For sure, we will not put everything together, but we are still thinking about how to do it depending on the results and data extraction.